Hello, welcome to the Osteophysio YouTube channel. Today we're going to be talking about why do I get pain around the back of my ribs. So there's a few different causes of this. What we're specifically talking about, Louise, if you just give us a little twirl, is any pain on the back half of her, basically. From here down to about here, down to the 12th rib there. Quite often the pain will be on one side if it's a rib pain. Sometimes you'll get it on both sides if it's referral cause, but typically it's going to be one-sided. The most common cause is a rib head dysfunction, probably.
Yeah.
So where the rib attaches into the spine is a very, very tight joint. There's a lot of ligaments there. It's all held very, very tight. There's a little bit of movement for breathing and for twisting, and what movement there is really, really important. Quite often, if there's a little bit too much movement, you can get a terrible spasm in that area, and it's very, very painful. Yeah.
And I say, as the rib head comes in, it actually blends with two types of joints. We've got our costotransverse and costovertebral joints. So this is where they basically blend with the spine. Really common symptoms that we see in onset is maybe coughing and sneezing, like we said, for pain around the front. But most commonly it comes on, like we said, any kind of big breathing as you're opening up through the ribs, or any spinal movement. Because you're thinking, if it's locking in and we've got inflammation around the muscles around that area, inflammation around the joints of the spine as well as the rib head coming in, inflammation of the ligaments, anytime we move the spine, it's obviously going to be impacting that attachment.
Yeah.
And so what we would want to have a look at is kind of freeing up around the area, movement into the spine and relaxing around the ribs into the intercostal muscles.
Yeah, absolutely. And as osteopaths, it's quite satisfying if you can locate that rib head, and we can sometimes put a little adjustment into it, and it just sort of pops it back into its correct function, basically. Another cause of it is sometimes sleeping with a mattress which is too soft. So if you go around to your grandparents' house and sleep on an air bed or on the sofa or something like that, that's a common cause we see a lot of, isn't it? Yeah. Just where the back is sinking into the mattress below, and everything's getting pulled out of alignment and then held there overnight.
Yeah. And so another cause of pain, another condition that we look at is somatic dysfunction, or dysfunction of the spine itself. So pain within the thoracic spine can also refer not only out into the ribs, so obviously we're looking at posterior rib pain, so can refer outwards into the ribs or very localized into the spine. And you normally find that if it has locked in a position, so if there's a facet lock or a capsulitis of the facet joints of the thoracic spine, i.e. the ones that are helping us rotate, bend and extend, what you find is actually going into a specific position is actually relatively comfy, so where it's being held, as soon as you try and go the opposite way, there's that resistance. And so that's what we would have a look at. So normally you've either sat awkwardly, or you've lifted something funny, or you've twisted into a position and the pain has been triggered, localized into that area.
Yeah, absolutely. And a lot of people sitting at their dining room tables at the moment, working from home, sat in awkward positions, hunched over. And it's just having those vertebrae held in that awkward position for a long period of time, and it causes this pain and dysfunction.
Yeah.
Another thing to talk about is trigger points, so specifically in the rhomboid muscle, which is between the spine and the medial border of the scapula there. So what the rhomboid does is it pulls the shoulder blades together, and it's a key stabilizer of the whole shoulder structure. You can turn around now, obviously. So if it's overworked, or you've got a problem with the shoulder, you're not moving it properly or whatever, that can cause trigger points, and it can be excruciatingly painful. So you know it's a trigger point sometimes just by pushing on it. You can actually relieve it pretty easily sometimes.
Yeah, and you find that it's quite localized, and you can feel it almost like a nodule in the belly of the muscle. So that's a really common symptom or cause of posterior rib pain. Going on from that, so similar kind of pattern or trail of thought is that you're looking up into the latissimus dorsi and the QL muscles. So these are all muscles that blend up around into the spine, around the ribs. So what I mean by that is if you've got particular tightness in those muscle groups, they can pull the ribs into a slightly different position or hold you into a slightly antalgic posture. So posture due to pain. So you've got your lats coming up from the pelvis all the way up towards the shoulders. So really common kind of trigger points down through there. So if we've been leaning over the side of a sofa, or we've been twisting and turning, you can get a lot of tightness through there. Same with the QL. If we've been quite stressed or our breathing's been altered or tightness in the ribs, it helps with that movement of the 12th rib and then lower down. So you can get a pull and a pain down around the flanks and into the back of the spine. That can also refer down around the lower rib cage, around the back.
Yeah, and tension in the diaphragm as well. Less common cause. But if you've been very stressed, you're not breathing properly, or you've been sat in an awkward position, tension all around the diaphragm can essentially pull on the lower back and around those lower ribs, and that's a common cause of posterior rib pain as well.
Yeah.
And with all of these things, it's usually never one thing, isn't it? You know, when someone comes in with pain around the back, it's a combination of things. So they've got a little bit of a somatic dysfunction in the spine, in the vertebra. The rib head might be slightly awkwardly moving. There's likely to be some myalgia and some trigger points in those muscles as well. What we want to do is we don't worry too much about what the actual tissue causing pain is. We want to know why is this area not performing properly, why is it not functioning well, and typically it is because of the other things around it. So you know, perhaps restriction in the shoulder, perhaps the neck's not moving very well, there's stress, so they're not breathing properly, so on. There's a whole million things that can contribute to it, and that's what our goal is as osteopaths, really, is to find out, you know, what are those main things.
Definitely.